Hi, I'm Dr. Tsourmas. Today you've chosen to learn about medial collateral ligament injuries of the knee. A very common sports injury, a very common work event. Hopefully in your medical records you'll document either the direct or indirect trauma the knee suffered or the combination of activities that the knee probably suffered at work as well. This is important because medial collateral ligament injuries often are not isolated injuries. Let's examine this knee for a medial collateral ligament. Let's find out from a bony landmark where we are in the knee. Let's mark the patella, superior, inferior, medial, and lateral poles. 1 finger breadth below the inferior pole of the patella is where the femur articulates with the tibia. That's your joint line. Now let's isolate the structure we're interested in, the medial collateral ligament. A structure that really on the inside of you anatomically is probably as broad as your 3 fingers on your hand. Let's mark in blue where this goes from the medial femoral condyle to the medial tibial plateau. So now let's do the classic valgus stress test, both extended, the knee fully extended, and slightly flexed. And watch what happens to the joint line as we cradle the femur, cradle the tibia distally so we get good leverage effect, and we apply a valgus moment to that knee. Watch the joint line and you can see some subtle opening. This is a mild grade 1 ligamentous instability with a definite endpoint. Another little trick in medicine is what you can do with this knee if there's a mismatch between a small examiner and a large patient. Sit down, examine the leg on your lap, let the table break that knee 20-30 degrees, and now you simply cradle the knee without any weight at all and do the same valgus stress testing. Watch here what happens to the medial joint line when you apply the same forces. Your clinical notes, both the positives and the negatives, are crucial so that you and Texas Mutual can arrive at the correct diagnosis for this patient and his injury. Thank you for watching.